when it comes to flossing, the best time, I mean, at least once a day, you want to floss. If you have, the kind of teeth that have a lot of spacing in between, you've had a lot of work done in your mouth, or there is some kind of recession or bone loss where there is more, like spacing, like let's say there's a lot of room between the teeth, then, food will get stuck almost every time, anybody eats like an actual full meal. So it's, a lot of people are tempted to kind of get that clean, which is great. You don't want to let that sit there, but definitely at least once a day. And there are many different kinds of flossers out there. For people who have good dexterity, they can use their hands just fine. They have no, limitations. I would say just a regular floss, like really just any regular floss. One that is, this is, I believe, Glide, which is, it's Glide, which is supposed to be a little easier to kind of go in. Some people like it, some people don't like it. But the best way to hold it is really, it goes around, just kind of wrap the extras. There's a good amount here. I have a lot of, floss. So it kind of gets wrapped around the middle, finger, and then using my thumb and index finger, I'm holding it. Okay, so this is just like a lot, but I'll just come close, create like a little bit of, space. And you see how it's like a C shape kind of? That will create, a little arch that's then going around, each area of the tooth. So let's say I am like, flossing here, it will get the edge, it will go in and kind of clean the side of one tooth, and then the same area will get the back tooth. So each contact, each area has two surfaces. It's the front tooth and the back tooth. So you kind of want to get those two areas cleaned out, and you form the floss. With these flossers, with these regular flossers, you can really form it to get that whole surface area, and you kind of move over and use another part of the floss to the, at the next site, and just go from there, throughout your mouth. This is, the reason why I like this is, one, because you can, versus the sword flossers, the one that comes with a piece of floss, is it doesn't form to that surface, so it's kind of like straight. And if you have a particularly tight contact, a lot of people tend to like shove it in and like cut their gum, and then they're like, oh, I bleed every time I floss, or it doesn't, get that surface really well. So if there's somebody who gets a lot of food particles stuck there, they're like, it's not getting it out, it's not really cleaning it so well. So that's, why I like the regular floss. There's also Waterpik, which is, Waterpik is just the brand name. It doesn't have to specifically be Waterpik, but it is, a machine that kind of sprays a very, defined, amount of water on their pores, and that will clean teeth for people who have more of a difficulty kind of using the floss, and the dexterity is not there as much. So it really will kind of do the work very well. Some of my patients floss and use the Waterpik. They really, want to keep it very clean. But, one will do. There are also flosses that are just the regular floss that expands as it just goes in between your teeth. So once it's in between, kind of expands and cleans out a lot better. But yeah, anything really. If some people are on the run or they don't have the time to do this kind of flossing, which takes a lot more time and like concentration. So I'd say use whatever you can, the sword flossers, the toothpick, whatever, as long as you're kind of getting that food particles out, that's all that matters. You know what? Whatever works, as long as you're kind of getting the food particles out. And some people have really, it gets really frustrating if there is, a restoration that's not really done very well. I mean, that's actually a good reason to know you need to go and get that restoration fixed. But if it is from some kind of filling and that doesn't have the right contour, more food can get stuck, and then you really want to clean that area, because otherwise it's just gonna cause recurrent decay, and it's gonna get worse over time. So that is one reason to see a dentist, to kind of get that fixed. But sometimes it's not something we can do anything about, or you don't want to have gum surgery because you had recession or bone loss. Some of that, either there is not much we can do about it, or people don't want to go through a surgery to kind of reverse it. So that's a good reason to kind of make sure you're using floss properly and cleaning everything out. I would say it should start as early as possible when the teeth are in. It's good to get them used to it. Younger kids generally have spacing between their teeth, so you don't necessarily need to floss, but it is about acquainting them, like kind of familiarizing with them with the floss and the idea of flossing. As permanent dentition come in, and the milk teeth, the primary teeth start falling out, and the other ones kind of start erupting, that's when we really want to be more careful with flossing. And a lot of times when you have that crowding, then you really want to make sure you give it some attention. I usually recommend that with younger kids, the parents always take a turn with flossing or brushing, mainly brushing really.